is data. How many of you have tried to look for data on the language needs of the population? Okay, this is something you're going to have to do for your plans, and it doesn't exist. Okay, so how many of your agencies collect data on providing language services? Okay, because very few agencies have this set up, where they're already collecting how much you're spending on language service, for what language it is, what dialect it is, how often a person comes. So this is, or whether it's one individual needing 15 times, or whether it's 15 individuals. Very few agencies are doing that. Even many of the interpreter provider agencies aren't doing that. So very few agencies have data, their own data, and then the other thing you look at is government data if you don't have your own data. And government data is also important because you kind of need to know, well, just because these people are coming to me, who are we missing? And the government data is really lacking in terms of a breakdown of the languages that Hawaii's population speaks. And for the Micronesian languages, for example, the data simply does not exist. So it's difficult for you to identify your relevant population this way. One of the things that's really important is outreach, because you need to know who's not coming to you. So for some agencies, it doesn't matter because they're going to come to you because they need to come to you. For most social service agencies, you have to do outreach so people will know that your services exist. So this is really an important element as well.
Explain, Tony. Yeah, it's interesting because even at the University of Hawaii, we offer services, and we needed to submit a plan, a language access plan. And we're thinking everyone's a college university student, they have English, and so what do they need plans for? I mean, but then we're not talking visitors, we're talking students. And so when I think about the services on campus, we think about counseling services, health services. And I remember I went to my class, and most of them are foreign students because I teach interpreting classes, and so most of them are foreign. And I was asking the Japanese and the Koreans and the Chinese, so where do you go to get your health service? And the Japanese says, oh, in Waikiki, there's that Japanese speaking, da 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 da. And I said, you've never been to the health center? Oh no, this is health. And I thought, what does that mean? It's very important. We need to make sure I said, oh, so the doctor speaks Japanese in the Waikiki? Oh, no. It's just the receptionist speaks Waikiki. Speaks Waikikian. No, speaks Japanese. And I said, so you're using an interpreter? Yes, but I know that there is one. And I said, that is so interesting. I said, what about the Chinese? You go to Waikiki? Oh, no, we go to Chinatown. I said, but the health service is right on campus. No, we know nothing about it, and I'm sure there's not any kind of interpreted. I said, did you know that there's a counseling session? There's counseling services. And two people raised their hand. Of course, they grew up here in America. And I said, how many of you think that if there's counseling services now that you know, how many of you think that if you needed an interpreter, you could get one? And no one raised their hand. They said, there's no way. And so if their mindset is, if I go there, and I said, why would you even want an interpreter? You speak English. No, this is my feeling. This is personal. This is, I can't explain. It's just, I just don't want to do this in English. I thought that was very eye-opening.
So Cindy, what did you do? So what now? What did you do when you had your epiphany?
Word again, epiphany. Well, first of all, it was going back to the center, going back to my colleagues and staff and talking about my epiphany and all that I had become aware of. We started dialoguing about the different experiences the clinicians had in working with interpreters, some of the challenges that they faced, and some of the times when it went well. And started to share the information that I had gotten. It was the beginning of training for us, and it's still at the beginning. We have much more to do. Sue came in and started some of that for us, talking about the role of the interpreter, the role of the service provider. We also, after I got a better sense of some of the challenges that the staff were experiencing, I set up meetings with individuals who we get interpreters through, so that we could talk a little bit about their process and their structure, and some of the challenges faced, and some of what our needs were as a service provider or service agency. We also began, I guess it's kind of a language access needs assessment. We took a look at the numbers of people that were utilizing our services who didn't speak English fluently, and our numbers were very low. We looked at the languages that were needed, and it was hard because we didn't collect very good information at that point, and we're still in the beginning of all of that. What we also did as part of that needs assessment was we took a look at the different points of entry for our agency or our program, and we had the ER, we have our office for the in-person counseling, we have the Children's Justice Center, a variety of different points, our hotline, our 24-hour hotline. And we took a look at what needed to happen so that language access was available for people. What we did was we looked at the important forms, our documents, our consents, and some of our releases that had some legal piece to it, and we had those translated in 12 different languages. We were at that point also working with NALOYO, a immigrant law center, for those of you who are not familiar with NALOYO, and through their support we had a victim advocate, an immigrant victim advocate that was identified, so that we had somebody who was a little bit more aware of some of the issues. So anytime we have somebody who is a LEP client coming in, that's the person that they're able to work with. And through NALOYO's support, we developed an immigrant victim service brochure. And that brochure got translated into 12 languages. It was specific to the immigrant population because, you know, they have their own special needs and concerns, immigration status, things like that. And so that incorporated all of that, as well as an explanation of services and sex assault in general, which we discovered was quite a challenge because just describing sex assault is very difficult in some languages. What else did we do?
Oh, the telephonic interpreter.
Oh, being a part of Kapilani Medical Center for Women and Children, the hospital had access to Serocom, one of the telephonic interpreting systems, and so we plugged into that, and so that at our when we have any calls coming into our hotline at any given time, we're able to provide interpretive services that way. And then we worked actually with Du, and we continue to work with her in developing our language access plan. And through that, more and more information on our need for outreach is becoming underscored. We're working with different populations. I've had a chance to work with Louise as we focus on some of the needs of the Chinese population, Du and the Micronesian population. And we're beginning to realize more and more that just because we have these really nice brochures now and nicely translated forms, they're not coming to us by droves for some reason. What we're realizing is we really need to get out there and do our outreach and provide information in a meaningful way. It might even take the form of a cooking class, remember Louise? And talking about our services through that kind of format. But be really thinking outside of the box, because we really do want to be able to bring our services to everybody. I think the immigrant population is very vulnerable to sex assault, and so it's our duty, I think, to find ways to bring it to them.
So, well, Sue, what else, I'll talk a little bit to start about what else can be done. Really planning. And it has to be planning for effectiveness and efficiency, which means that your needs assessment should count. I mean, it shouldn't be just for show. You should really be trying to figure out what your population is and what their language needs are and in what areas. The second is budget, and this may be close to the hearts of many of you, for services for translation and interpretation, and also for training and awareness for your staff and professionals like within your organization. I guess what I would say is, does it feel overwhelming now? So manage the overwhelming feeling is my third point. And I know that this is being advocated by Ola as well, is break it down into phases. I mean, you know, first of all, identify your critical services and documents. And you know, so which ones are the ones that are most critical? What documents really have to, because they affect rights, need to be translated. But it's not as simple as that. Once you identify it, you actually have to have a system for delivering your services. So, okay, you know, these are the services that are critical. What is your system for delivering these services to LEP persons? And forms are not all that easy. Once you have them translated, you still have to have a procedure for how you're going to use those forms. Whether those forms are going to be English on one side, if it has legal significance, and the other language in the other side, which side do you have the client sign? So there are all kinds of protocol and procedures you're going to have to deal with when you're doing forms.
Including who?
Including who's going to sign?
Including who's going to translate it.
Oh, right. Oh, yeah, that was, right.
Just real quick, because a lot of people call themselves translators, and they do translation, but it's not necessarily quality. So there's a number of steps you can take to ensure that a quality translation has been done.
You have to identify your high demand languages. I just talked about all the barriers to doing that. Just examine your data, poll your staff, which is what we did at the Sex Abuse Treatment Center. Ask the staff what languages they were seeing most frequently, and try to figure out who's not coming to you, who should be coming to you. So I mean, if you know your area really well, your instinct will basically tell you that, you know, these people should be coming to us, but they're not coming to us. Find for everybody else that besides your high demand languages, your critical services, you're still going to have to provide language access to those people. So you need a protocol for how you're going to handle populations that are not already covered as high demand, or services that are not identified as critical. The only thing I can say about that is have one or two people, not just one. You should have two, because there needs to be a backup if that first person's not there, who are experts in the field and can actually help your staff decide what to do or figure out what to do if you have someone who's not otherwise covered by your language access plan. Training, start your data collection system, and the last thing I have is don't forget outreach. And we're talking about this, that outreach is not, let's outreach to everybody who doesn't speak English, because every population is different. So again, you have to decide who your critical population is. But you know, Cindy, in working with the Chinese population, had mentioned that, you know, you have to do it, do a cooking class and do it in connection with a cooking class. There's several people in this room who are on a task force that I've been working on to develop a sexual violence prevention plan for the Micronesian communities in Hawaii. And it was really eye-opening for me to work with those populations, because they're all individual populations. So there are many populations within the population, but also because talking about sexual issues is really taboo within most of those populations. So a lot of the way we had to frame the outreach really had to do with trying to diffuse how charged just using the words sexual assault or sexual violence were. So again, you have to look at your individual communities, and outreach isn't one for all. Cindy did a really great, if you're going to do brochures for immigrants, never ever, and this is going to be my mantra, don't ever think that something in English can just be translated or interpreted into another language and it's going to be just as effective, because it's not. I mean, really think about the population that you're trying to reach and what's going to be culturally appropriate and what's not going to be culturally appropriate. And don't take the easy route and just say, well, we'll take this particular form or information that's already in English and we're just going to translate it to another language because that'll work. It's not going to work. Other ideas? Make it count. That was my last thing. Make it count. If you're going to make the effort, make it count. I mean, don't just do it because the law tells you to do it. Do it in a way that's effective. We talked about the difference between translation and interpretation. How do you know if the interpreter is a good match? Well, this is my list, but you probably have your language. They have to be understandable to the client, and you have to be able to understand their English. Okay, some of you I know have had interpreters where you couldn't understand their English. Right? Okay. That's not a good interpreter. The conflict of interest issue, be really sensitive to whether the client is uncomfortable with the interpreter for any reason. And you have to know, your interpreter needs to know the specialized terminology. as well. We didn't talk about this, but sometimes there's bad dynamics between the interpreter and the service provider because they just don't like each other. Or, you know, an interpreter and the client. And you know what? That's valid too. I mean, if you can't get along with the interpreter, it's valid not to use that interpreter.
Just a short one I'd like to comment on. You said earlier that the two fundamental foundations is the skills training and the ethics. And I know that you can train for skills, but not all of ethics can be trained or learned in formal education. Could you address that a little bit? I know you alluded to it, sort of, but if you could repeat, what do you do? Go around it or head on directly, meet that issue. Thank you.
Yeah, when we talk about ethics, we're not talking about personal ethics, like, you know, you should be a good person and things like that. We really mean the role of the interpreter. Just like lawyers have their ethics and they can break their ethical codes, and realtors have to abide by certain ethics. A lot of them are actually under laws, and they could be sued or they could lose their license for doing certain things. For example, a lawyer cannot tell their defendant to lie on the witness stand, for example. Well, interpreters also have developed standards. And I know that the ASL interpreters were way ahead of the spoken language interpreters, but there are standards that have risen that we almost take an oath under to say, whether I agree with it or not, I'm agreeing to the role of the interpreter is not to give legal advice. The role of the interpreter is to keep confidential all the information I learn. The role of the interpreter is I can't, you know, any kind of, I need to interpret accurately, et cetera, et cetera. So, right. So there's actually a role there's a role of the interpreter, and Jan is going to be talking about that. So it's not personal ethics.
Yeah,
thank you.
Thank you. And Jan is going to stop talking already.
There's some other questions.
Yes.
Okay, I got 2 points. I really appreciate all of the experiences that you three has in relationship to the different issues that come up that sometimes you were wondering about or amazed about it. Now, when you do your training for the interpreter, are you incorporating those issues that just come up so that your trainee would be relevant to all of those issues? That's one. And the other one is, you're talking about interpreter, but I just would like to know, who are you talking about? Is this grown up, or are we also talking about youth interpreters? Because I know that there is a big, I guess, need for youth's interpreter because of the issues that we're facing with the youth at the present time. Thank you.
Yeah, I actually was going to mention this, but didn't. For most of you, I talked about family members and friends and that you really shouldn't be using them. But you should really never, ever use children to interpret, especially for their parents, for their uncles and aunts. Just, I mean, if there's any way you can delay interpreting because you only have a child to interpret, don't ever do that. But the first question was about what's incorporated in.
I think any kind of professional training in community interpreting, we always cover ethics. It's just a huge part of it, besides skills, like note-taking or simultaneous interpreting skills. So yes, it's always covered.
Yeah.
I think we have probably time for one more question.
Yeah.
Hi, thank you. This question was for Cindy. You talked a little bit about how you're keeping track of the access to interpreters